Professor Paul Garner, lots of people getting in touch about it. How are you this morning? Long COVID expert.
I'm good. I'm good. Thank you.
All right. And I know you were diagnosed with it yourself. What is it?
Well, it's a mixture of things. So after the pandemic started, a number of people were hospitalized, and a number of people just didn't recover after a few weeks. They had recurrent fatigue, bizarre headaches, burning sensations in their body, a massive myriad of different symptoms. And it seemed a very bizarre and unusual condition associated with the virus. And certainly there were some people that had been severely unwell, who'd been in hospital, and it takes such people are going to take a year to get better over their illness anyway. But then there's this group of people that, of which I was one, who were really smashed by the virus, but without any abnormalities being found on tests at the doctor. The illness would go away and come back again, and nobody really sort of understood what was going on. But it's becoming clearer now that there is that the virus triggers a sort of an alert response, a set of primitive alarm mechanisms in your brain that compound with the stress of the pandemic will create these very real symptoms that people are experiencing and finding difficulty.
Can I stop you there? So there's a physiological and there's a psychological, are you saying, combined with the stress of the pandemic? What exactly do you mean?
Yes. So this is the bit that people struggle with, because the brain, inside our brains, we have these deeply evolved mechanisms for protecting us against danger. And these mechanisms, these alarm mechanisms in the brain, will respond by shutting us down and making us feel ill. That's what happens when we get ill. So you have a double whammy with the pandemic, because you've got a brand new virus that is going to stimulate alarm systems and illness in the body. And then you have this societal panic. And on top of that now, we have this concern about an illness that nobody sort of knows about and might go on forever. And that in itself influences how people recover. So there's something called the nocebo response, which is where you actually have an illness, you have symptoms as a result of the fear about it. So it's important that people understand that the symptoms are real, generated in the brain, and are a response to danger.
Right, okay. Obviously, this is fascinating. You've been through it. I know people who are going through it. As ever, with any scientific claim or medical claim, there will be those who disagree as well. Suffice to say, it is real. People are going through it. Maybe there are different forms of it. Is there a test for it?
No. So
has there been peer-reviewed papers on this yet?
There's been papers looking for tests, and you will find with a stress response that hormone levels will change, cortisol will change. There are changes that happen in the body as a result of the stress response. You know, if you're frightened of something, of fear, your pulse rate goes up, your massive hormone releases, you don't sleep well. So obviously, when the brain goes into this alarm mode, there will be changes through the body. So there's been lots of peer-reviewed literature looking for little changes and small changes, and some of the, and some have there's some indication that the immune system gets overstimulated, so there's lots of antibodies shown.
Okay, so suffice to say, what people are going through is horrendous. I know that. We know that. We hear from people. You've been through it. Lots of other people getting in touch with us. We all know people who are going through it. But as for the physiology, we are still very much in the foothills. Stay there. We've got Sam to talk to. We've got Andrew to talk to. We've got Jim Reid, our health correspondent. I want to speak to Dr. Amy Small, an NHS GP. You've supported long COVID patients, Amy. You know that, but I'm just telling everybody else. And you've had it yourself. What is it, and how many people come to you who are going through it?
Hi, yeah, thanks. What is it? The definition is any symptom that lasts more than 12 weeks after your initial COVID infection. That's how we define long COVID. I have to respectfully disagree with my colleague. It is so much more than what I believe he's saying. We are seeing there are papers coming out now. There are various different mechanisms which work for long COVID, and I think that's part of the problem. Is it's a different disease in different people. So some people get what we call microclots. So we're seeing that blood vessels are getting inflamed. Their blood's becoming more sticky. I don't know if you remember back at the beginning of the pandemic, people talked about COVID toes. They had purpley patches on their toe. That was something that was discussed quite a lot at the time. We're seeing that people are getting blood clots in their system, and it's causing problems from rashes to breathing problems to how their brain is functioning. People have a significant amount of cognitive difficulty as a consequence of COVID. We're also seeing that people's immune systems have just gone massively on alert. So the COVID infections come in and it's triggered an immune response, and people are getting massive inflammation of various different aspects of their health that's being affected. And I think that's the problem, is it's so many different illnesses, and it's different illnesses in different people. I think if you're ill for any length of time, of course you're going to get distressed by it. Of course you're going to have issues with anxiety and depression.
Which stops you getting better as well, right?
Well, I think that there is going to be an element of that, but I think we mustn't forget about how people just haven't had the right medical input right from the beginning. They haven't had the right support. So if we think back to 2020, when people couldn't get access to healthcare professionals in the way that they would have liked, we weren't seeing people out in the community. People were staying at home and were looking after themselves and really festering. And they were often pushing through. And I think that's what we know with COVID. When you're ill at the beginning, the more you push through, the more you strain your body, the longer it takes to recover. And then that disability sets in. So as that happens, your body is then becoming really more and more unwell the more you're trying to push through it. And what we really need is for people to have early access to services that can help support them from early on so they don't get to that disabled point.
Pleased to welcome on Andrew in Shrewsbury and Sam in Hebden Bridge. Hi, Andrew. Hi, Sam. Good morning, Sam.
Yeah. Hi, Nicky. How are you?
Fine. We had an exchange on Twitter the other day. You thought we didn't concentrate on this enough, but it was always our intention to return to it. And I'm glad we are doing that. And you sent me and you sent others a really powerful video that you made describing your life and how tough it is. So tell our listeners, it's pretty dreadful.
Yes, I've had to make a few notes of things because one of the things with long COVID is that I have terrible neurological symptoms, so I forget such a lot. But long COVID for me is very much, there's a stigma attached to long COVID, but I want to tell people that long COVID is a really terrible disability. I'm glad that the doctor mentioned the word disability because that's definitely how I see it. I mean, I know that not everyone is as ill as me. Some people are more ill than me. But my experience at the moment is I got COVID again back in July, and that every time you get COVID when you've got long COVID, that makes you so much worse. And the most recent bout of COVID that I've got added to my long COVID gave me like dissociative episodes. It gave me a great deal of suicidal ideation. What I wanted to say specifically to Dr. Garner, what he says about the psychological side, I have to say is absolute nonsense.
Well, we're getting a lot of people saying that it's absolute nonsense.
Yeah, long COVID is a vascular disease. It's a disease of the blood. It's not primarily a respiratory disease at all, even though you have respiratory symptoms. My long COVID is severe, and long COVID is spread. It's airborne. It's an aerosolized virus, not, as Lisa Ritchie says, through droplets. And I also wanted to take exception to what Dr. Van Tulliken said on BBC Morning Live yesterday, where he said that most people recover from long COVID. I can tell you, having had long COVID for 4.5 years, I'm getting a bit emotional talking about this because it's been so long.
4.5 years?
4.5 years, yeah, since March 2020. I can tell you that most people don't recover. Office of National Statistics survey said that currently about 3.3% to 4% of all the UK population has long COVID, and that includes 1% of all children. It's a multi-system disease. It's got over 200 symptoms. But for me, it means that I can't work, I can't drive, I can't exercise much. And I keep forgetting things. I mean, if I hadn't known this was Tuesday, I'd have forgotten it was Tuesday.
What was the Sam in Hebden Bridge like? And you do have to. I write stuff all the time to remind myself of things. This without this notebook, I would be a gibbering wreck of a broadcaster. But that's fine, and you're sounding great, and you're expressing it all so well. What was the Sam in Hebden Bridge of 5 years ago like compared to the Sam now?
That's a fantastic question. I've got dogs. I used to walk for hours with the dogs. I was a runner. I was a keen cyclist. And before that, I was working at my daughter's school. It's had such a massive impact, not just on me. I mean, it's very important that you ask what my life was like, but it's had such a damning effect on my daughter. My daughter has gone from seeing me as being fit and active, I was like her adventure dad, to someone who often struggles to get out of bed, and it's really affected my marriage. All the plans that we had, to do stuff like when we retired, my wife wanted to buy a camper van and travel around the country. My wife sat opposite me crying at the moment. We had so many plans, and we can't make plans anymore. We just have to take things one day at a time.
What's the way out? What's the future?
There isn't really a way out until there are treatments. And I have a message today for Andrew Gwynn. Andrew Gwynn is the Minister for Public Health. He's actually got long COVID himself.
I remember, yeah.
He hasn't said or done anything since he got into power. The NHS hasn't licensed anything. In China, since 2022, they've been giving out repurposed HIV drugs to people with long COVID. Here in the UK, they're doing absolutely nothing. And they're not just doing absolutely nothing to find treatments. They're doing absolutely nothing to prevent the spread of long COVID. As I said, it's an aerosolized virus. So I'm sure you remember that most of us wore masks. I'm sure you also know that clean air is available. Like for Andrew Gwynn himself, he had clean air in the Houses of Parliament. I have an air filter at home, and lots of people I know with long COVID have got air filters. And for me, it's not really very safe for me to go out, because everywhere I go, even if I wear a mask, I'm not safe. I'm liable to get COVID again. I mean, I do keep getting COVID again, because one-way masking isn't enough. Without clean air or without other people wearing masks, it's very hard. There's this thing called the social model of disability, and it's basically that society, non-disabled society, is meant to make space for disabled people, but what we're experiencing at the moment is the complete opposite of that.
Well, listen, Sam, stay there, and Andrew coming up as well. I want to speak to Jim, who is our health reporter who's been covering this and covering the inquiry. Jim Reid, the inquiry is looking at long COVID this week, right?
Yeah, that's right. And in particular, it's looking at the impact on NHS staff from long COVID. Now, that might seem, Nicky, like a bit more of a niche issue, but you've got to remember 1.5 million people in the UK work for the NHS, one of the biggest employers in the world. Some new research out from King's College a couple of weeks ago on this looked at healthcare workers, and about a third of the healthcare workers they asked had some form of long COVID symptoms, because obviously these are people that have worked very closely with COVID patients. Only about 7% of those have got a formal diagnosis. And if you look at what's been going on with sickness rates, not just in the NHS, but around the country in general, they have been going up quite significantly since the pandemic. And one of it's more than a theory. One of the ideas behind this is that long COVID is at least one of the factors behind this that's causing this increase in NHS staff taking time off.
And so what are the scientific establishment doing about it? How are they addressing it, the medical establishment?
We just heard from your caller there about trying to develop treatments. I think the first step before you can develop a proper treatment for long COVID is to work out, exactly what is causing it. And as you heard from Amy, one of the doctors earlier on, it's such a wide subject. It's unlike there will not be a single cause of long COVID. It'll be different depending, almost like a different condition, depending on what your symptoms are, how you contracted it, how your body reacted. So there's been some really interesting research in this area. One of the kind of leading theories at the moment is that, as you heard earlier on, your body is reacting to COVID in a certain way, reacting to the virus in a certain way. And that's causing an autoimmune response, an inflammatory response. And this is being picked up in blood tests now. If you look at the proteins in the blood, depending on what your symptoms are, and if you suffer from fatigue, if you suffer from brain fog, the symptoms, the proteins that are being identified are different. So if you can find out exactly what's causing this inflammatory response, you can start to do something about it. But this is something that is going to take a fair amount of time. There's not going to be a cure for this overnight.
Well, let me bring Andrew in as well, and Rachel in Plymouth too, who's a GP. Hello, Rachel.
Hello, hi, thanks for having me.
I'm glad you've come on because you've heard something, not from Sam in Hebden Bridge, who was superb, but from the previous professor that you think it's important to correct. Obviously, lots of people have lots of different theories. What we need to do is focus on the facts and make sure we help people. What would you like to say,
Absolutely.
Rachel?
So, I think Dr. Small mentioned quite a lot of this, actually. She did a great job. But Paul Garner, no one who's been paying attention to long COVID over the last 4.5 years would agree with him. We have got so much evidence that this is a real structural, pathological condition caused by a variety of things, because there's a variety of different ways it presents. So we know there's problems with, it's a vascular disease, it's an immunological disease, and there's combinations of things. And like any chronic disease, when you've had it for a while, it affects you psychologically because it's distressing. But it's not caused by your psychology. It's caused by the physical changes in your body due to the virus. And it's terrifying. I've got long COVID. I caught it. Unlike the caller from Hebden Bridge, who's got horrendous symptoms from the sounds of it and has been doing this for 4.5 years, I've only been dealing with it for coming up on 3 years. I got it at the end of 2021 in that Omicron wave of Christmas 21.
Yes.
I was fully vaccinated. I probably got it from a patient because we weren't given the right PPE in general practice. I was off sick for 15 months. I lost my job. I still can't work the way I did before. I'm luckily much better than I was the first 12 months. But I still can only work mornings. I have to sleep afternoons. I get problems with brain fog and confusion. And it's not psychological. I'm on some medication that helps. And it's very clear from lots and lots of excellent research that's being done that there's real structural problems.
Yeah, I did pick him up on it, as you'll have heard. A little alarm bell rang, but I don't think... Would you mind speaking to him? I don't want to make this a debate about that. I want to hear from people, but it's worthwhile having a short exchange between yourself and Paul, if that's okay. Paul, Paul, I think you weren't saying it's all psychological. You were saying there's a psychological aspect to it, which made it worse. Professor Paul Garner.
Yeah. I mean, Rachel is sort of highlighting the problem of dualism in medicine, of separating these two things. And of course there are physiological changes and the immunological changes and everything that's been seen, but that doesn't mean that cognitive approaches can't help. And the emerging research that's coming out in the coming months is cognitive approaches do help people. Physical and mental rehabilitation do help.
I'm sorry, Professor Garner, but that's not what you said. Your initial entry point to all of this, and what you said until it was countered, was that this is about a psychological mismatch and about people having a fearful response to the idea of COVID and to the pandemic. That's not the case. What you've got is people who are rightfully frightened about what is going on physiologically in their body, because we can't treat it and we can't tell them how long it's going to last. And they are rightfully frightened. And yes, a psychological approach to help them be less frightened of that helps them come to acceptance of their ongoing disability. But it does not fix the disability.
Yeah, Sam, yeah. I mean, what's becoming clear here, and what became so clear to me the other day after we mentioned it was mentioned by a brilliant caller on Friday, is the passion and the anger, if I can call it, and this phrase is often crass, the long COVID communities. There's a lot of rage, Sam, isn't there?
Well, there's a lot of rage, but I think my overwhelming emotion is actually grief. I mean, especially when I was talking about my wife was crying opposite me earlier, absolute grief at the kind of social abandonment and stigmatizing that we face, which is also going on with the Labour Party at the moment, all of this stuff about working people and not really taking any account of people who are not working. So, yeah, I would say that the cognitive stuff that Dr. Garner is talking about is absolute garbage. I went through
Mr. Professor Garner was seriously ill. I just want to put on his... I'm going to let you continue.
Oh, I know, but what I wanted to talk about was I've been through the long COVID clinic system, and the long COVID clinics offer a different range of what they call symptom management, and all of these are cognitive behavioral therapy based, and they're all just like sticking plasters, basically. And cognitive behavioral therapy, like graded exercise therapy for ME, is widely debunked and discredited. And everyone I know in the long COVID community, which is pretty much everyone, is very, very scornful, because it is very much a physical ailment. If I can, I know I'm hogging the radio a little bit. I just want to say one last thing, which is that something that Jim Reid said, because I know, Nicky, you said facts matter. Jim Reid referred to the pandemic as being in the past tense. The World Health Organization is very, very clear that the COVID pandemic is ongoing. COVID death figures this year have been, about 10,000 at the very least. And also studies show that nearly a third of current long COVID cases started since March 2023. So I just wanted to point out
you're right
to Jim.
You're right to do that. It is ongoing. I'll let Jim come back on that. But it's I think you're talking about the height of it in the UK, Jim. That's what you were referring. Of course, it's always going to be with us, and for vulnerable people, it is always going to be an absolute threat. But Jim Reid.
Yeah, I think.
Let me just get Jim to sort that one out.
Yeah, I think that is a fair point. I think when we talk about the pandemic, and you can easily lapse into talking about it in the past tense, but when we do that, we are talking about the acute pandemic, the acute phase, those peaks of the pandemic where we looked at people, ambulances queuing outside hospitals, that kind of thing. Obviously, the pandemic is still ongoing. The WHO haven't said that it's the end of the pandemic yet, and I think it's a fair point to raise.
Just a quick one, Paul Garner. I don't want to leave you on an island, deserted here, drifting away, but you are doing research on this, aren't you?
Yeah, so I think people are misinterpreting things. I respect what Rachel and others have said. This is clearly a medical, biological illness, but that does not mean that psychology and prediction has no role to play in rehabilitation. So, and all the biological and medical responses that were being described are real, and I had them, and I don't, we know that they're there. But this does not mean that if you say cognitive approaches does not deny that it's a real illness. And this is where people get things wrong. The emerging research is coming out that cognitive approaches do help. Physical and mental rehabilitation helps. And there's stuff about psychoeducation that will be coming out in the coming months about explaining the more complex biological response of the body to a viral infection and the perpetuation of symptoms that come out of predictive coding, a little bit like chronic pain. It's a little bit like chronic pain. So I think all I'm asking is that people are a little bit more pluralistic, or a little bit more just opening up to the fact that this medical condition.
I understand what you're saying, but Rachel, I think just to come back to you, Rachel, because I know you wanted to come in.
Giving my perspective as a GP rather than my personal perspective here.
Sure.
What I see is a lot of patients with long COVID, a lot of whom didn't know it was possible to get long COVID because they think COVID is over and done with. It isn't. And they're not vulnerable patients. It's all of us. And the more times you get COVID, the more at risk you are of long COVID. The psychological approaches are very helpful if they're put alongside treatments for the physical symptoms with a very clear line that they are there to support you in how you are managing your physical symptoms. That's where they're helpful and where patients feel believed and feel supported. When you're told the only thing that can be done for your overwhelming, dreadful physical illness is psychological treatment, that feels minimizing and that feels negating. And it leaves people feeling unsupported and it leaves people feeling desperate. And that's not fair.
I know that I'm going to come to you, Amy, exactly, because I heard you in the background. But Dr. Amy Small, what I would say is, I mean, but listening, very close, and I want to hear people's experiences. I want to slightly get away from this, but it's important that we address it because of what Paul said when he came on. And Paul did clarify. Many people will think he absolutely clarified it, but it's so dangerous. Amy is. I mean, it's a similar situation to ME, when people were told there's a danger of people thinking that you're saying it's all in the mind, and it's not all in the mind. That's the point, and that's why language is so important here, and precision is so important, Amy.
And it also allows the government to hide behind the fact that they can then say, well, it's all in the mind. You just need to fix yourself and think yourself better. We talk, Paul, from an immense position of privilege. We have education, we have houses, we have money, we have all the rest of it as doctors. So many people that I see day in, day out, and I work for a charity called Chest, Heart and Stroke Scotland that support people living with long COVID. These people are losing their livelihoods. They're losing their houses. They're losing their relationships. They're losing everything. I mean, I lost my job as well, like Rachel, and my roof was leaking and I had a mortgage to pay for, and I thought I was going to lose everything at that point. But I was still incredibly privileged. As a GP, I would always find some degree of work. But if you're Joe Bloggs down the road who's been a labourer your entire life and you can't breathe properly and your heart rate's up at 150, if you start to fit the narrative that this is psychological, you're just letting everyone get away with it. And then no one's ever going to be actually held to account to look at how we treat long COVID with medical treatments, which we do have. We do have treatments, but a lot of them are off licence. A lot of our colleagues aren't aware of them. A lot of our colleagues haven't had the training or expertise. But we need to start getting away from this psychologizing it, because that just falls into the government's trap. And I'm sorry I get really passionate about this, but people are losing everything over this, and the government is doing nothing. And they keep telling us that COVID's in the past, it's finished. We as doctors still don't have appropriate PPE. I caught COVID again at work last year, brought it home, gave it to my husband, who was then off sick for 9 months. He's only getting back to work fully now, a year down the line. I mean, and this is the second time for him with this.
Let's listen to Andrew in Shrewsbury. Was that you saying, "Can I come in, Nicky?" Because
yeah, please. That's okay.
You said it at exactly the same time that I said, "Andrew in Shrewsbury, come in." Go on.
Hi. Yeah. So first of all, thank you for having the programme. It's really great to get this out in the open, and also. I know you wanted to sort of move away from this area, but I think I'm in a particularly good place to comment on Paul Garner and other people's sort of resentment for this and disagreement. And I just want to say, my previous profession, I got ill 4.5 years ago as well. And I was running, I was doing ultramarathons, I was working as a sports psychologist, I was working at the FA, and I was also working as a senior lecturer in psychology at Manchester Met University. And off the back of that, I've been ill for the past 4.5 years, and I won't bore you with the details, but had a really, really tough time of it. I spent the entirety of 2022 in bed, unable to talk. unable to really listen. I had to have an eye mask on. I had to have the builder's headphones on so I couldn't hear my kids. I couldn't be a father, and all of the emotional stuff comes side of that. But fundamentally, as a psychologist, I've done a PhD in CBT, and I can categorically say that you cannot think your way out of long COVID. And the message that Paul Garner gives is absolutely critically in the minority of people, or the experts and the patients suffering with long COVID. Because I won't go into the mechanisms behind CBT and how it works, but it's really, as a HCPC practitioner myself, when I'm practicing, if I was trying to give someone a psychological therapy to try and treat long COVID, that is negligence. I'll be struck off from the HCPC registration, because that is not an actual treatment. The treatment has to be biological, it has to be physiological. And Paul's talking about there's lots of research coming out around cognitive ways of thinking. Actually, the massive research, the best research coming out, which there is a lot happening at the moment, and I think actually we need to stop sitting behind this idea that, there's not much research out there, we don't know, it's relatively new, because there's tons out there. And we talk about being in a position of privilege. I'm lucky enough to be in a position of relative privilege. I had insurance on my job, but I lost my job, so I can fund healthcare. So I've been down the private healthcare route, picking people wisely, and actually we're starting to understand and treat my long COVID using tests and using off-label medications to try and treat me. Yes, I've had psychological support. Yes, I've been taking antidepressants, but that's because my whole life has been turned upside down. And at least while I'm sitting in my house all day and suffering, at least I can try and look after that side of things. But is that going to get me out of this long COVID mess for the past 4.5 years? The literature in CBT says, no, it definitely cannot. My experience and experience of thousands and thousands of other people says, no, this isn't the case. And yes, this is long COVID, but you're absolutely right, Nicky, when you said talking about ME, because that's so important, because we're people like ME. People have been sitting in dark rooms and lying in bed for 20, 30 years because people have been saying, they're just lazy, or they need to think their way out of it, or they've got a psychiatric problem, which is absolute tosh. And I say that because I am a psychologist. I've been practicing, I used to practice for 7-8 years, working performance psychology, and my PhD was in CBT, one of the four, because CBT is, people talk about CBT, it's a broad umbrella term for many different types of therapies. And people use this term wrong. So when you go to long COVID clinic, they say, we're going to give you CBT, or we're going to give you physiotherapy. You've got a long COVID clinic there, which cannot fundamentally treat someone with long COVID. It's like going to a cancer clinic the doctor's completely. Not being able. Sorry.
Never apologise for your passion. You said it brilliantly. What contributions! Thank you, Sam. Thank you, Professor Paul. Thank you, Amy. Rachel, I want to ask you something else. Can you stay after the news, weather, and sport? We have to news and sport. As ever, it's you coming to us, getting in touch that makes this programme. And I want to ask you a question, Rachel in Plymouth, in just a second, a GP who has had long COVID, who texted the programme, and I'll be with you, Rachel. But Jim and Sophie and Denby as well. Look forward to talking to you, Sophie. But Jim Reid, our health reporter, following the COVID inquiry and following this phone-in very, very closely, completely understands how strongly people feel about this. And it fits into this week of weeks. It's entirely relevant, this, to the budget.
It's really relevant to that. I mean, I think you heard just how passionate individuals feel about this, quite understandably. But actually, this does matter to the country as a whole as well. Latest figures, Nicky, we've got on this. 2 million people in England and Scotland say they're dealing with long COVID at the moment. So those numbers are huge. Like you say, we've got a budget tomorrow. If you look at long-term sickness rates in this country, since the pandemic, they have been shooting up. We're now at a stage where for every 13 people working in the UK, one person cannot work because of a long-term illness. How much long COVID feeds into that because of the way they work out the data is really difficult to say. But I think almost every expert out there thinks this is now a very, very important factor in explaining why we've seen this rise over the last 4 to 5 years in people who are off long-term sick. And it's one of the things that the government is going to be under a lot of pressure to deal with tomorrow in the budget.
Thank you very much, Jim. Jim Reid, our health reporter following the COVID inquiry. Just very quickly, they're looking at this week. Right.
They are, yes. Today and tomorrow there's a big focus on long COVID and in particular how it affects the NHS and how the NHS can operate.
Yeah, so Sophie, hi. Anne, hi as well to you. And Rachel, right, you take GP, right. I walk into your surgery, Rachel, and I say, I think I've got long COVID. What do you say to me? What do you tell me to do?
I say, I'm so sorry to hear that to start with. And I ask you what you're experiencing and to find out what's going on. And the thing I really encourage people to do is rest. So the only, other than treatment for specific symptoms, so we've got treatments for things called POTS and for orthostatic intolerance, it's called, and for
I want to sort your line out. It's not a very good line because I really want to hear what you're saying. Not your fault. We'll just get it checked by the guys. I'll be right back with you. Sophie in Denby. Okay. Hi, Sophie.
Hello.
How long have you had it?
I've had COVID, long COVID, since April 23. Sorry. It's very difficult to pinpoint because I got sepsis in 2022 and was very unwell following sepsis for about a year. And then I got COVID November 22, January 23 and April 23 and continued getting worse. So officially I know for a fact that I've had it since April 23. But I was very unwell prior to that.
And as I speak to you now, how are you feeling? And it's a question I asked earlier on compared to the Sophie of the past. I asked Sam in Hepton Bridge that question. Then and now, what are the comparisons?
It's quite an emotional thing to think about because my baseline now for what I would have, if this is how I felt back then, I would be panicking and thinking there's something horrendously wrong with me. But now that I'm so used to this, it's hard to even acknowledge, how bad I feel. I'm not as bad in the morning until I do more and more tasks throughout the day and progressively get worse until I'm usually in bed at some point by the afternoon.
And you have the brain fog as well.
Yeah, that's why I was quite nervous about this phone call because, prior to being unwell, I always prided myself on being my use of language and being able to speak at length. And it's really, really difficult trying to catch my words and get my sentences out. And I feel like I've dropped IQ points significantly, like I've lost a huge amount of my intelligence. And I know that's probably the wrong word, but that's how it feels.
Yeah, you've lost your kind of acuity, that sort of thing. That kind of.
Yeah.
Wow. I think Rachel can hear us now, and I can hear Rachel. Rachel
can. Yeah. Hello.
You heard Sophie there. She walks into your surgery, and obviously you say that your heart goes out to her. All our hearts go out to her. It's heartbreaking. What do you say to her about what she can do in the here and now?
I find out what she's doing because so a lot of what Sophie's dealing with are symptoms I recognize personally as well as professionally. And the only thing that we have evidence that it works for the brain, specifically for the brain fog and the fatigue, so massively the fatigue, is pacing. And pacing is awful. It's boring and it's horrendous, but it means complete rest. So you have to take your level of activity down well below what you think you can do and rest and then slowly build. And you have to be looking at every single thing you do physically, cognitively, and emotionally and counting them all as work and taking time to rest after every single one. So right now I have dropped I'm sitting in my car. I've dropped the back. I'm parked up, obviously, but I've dropped the seat back to lie flat while I'm talking to you because it starts to get tiring talking this time of day and after a while. And I don't think it was the line before. I think it was my voice getting husky because it does when I've been talking for a bit. Because it's all work and you have to rest after work. And none of us are very good at resting. So I'm sorry I've forgotten the name, and this is one of my problems. But the caller earlier who's had such a dreadful time and was talking about having to wear an eye cover and headphones. that's resting. So no, in a dark room with no input is proper resting. I spent the first 6 months I was ill on the sofa with rubbish telly on, thinking I was resting, and I wasn't. Your brain has to completely rest between activities. It's awful. It is the most boring, dreadful thing, and you feel like you've lost everything important in your life. But it's the only, setting up that baseline is the only thing that then lets you build slowly.
Well, listen, Scott's on as well. I'm going to speak to Anne in Penrith in a minute, who was on the show the other day. But Scott, 15 years in the army.
Yeah, that's right, yeah.
Now what?
Obviously I got diagnosed with long COVID in 2012-13. Yeah, and obviously I ended up getting medically discharged from the army. So obviously I lost everything. Obviously I lost my house, lost my career. Obviously lost my income. And pretty much lost everything. I'm lucky at the minute that I'm sort of managing to work part-time, but even trying to claim disability benefits, it's just an absolute headache.
So you got COVID, and then you thought you were through it, but how did it linger? Did it go away and come back again, or was it always there?
Even when I caught COVID, I didn't think I had it particularly bad. I just had just your normal sort of. I had a cough. I had the fatigue. I thought after a couple of weeks it would clear up, but the fatigue never did. And obviously, I've gone from being 15 years in the army. I was extremely fit. I was running marathons most years. All of a sudden now it's I'm struggling to even manage 6 hours at work.
And the effect on your mental health must be devastating. We've been hearing it from Sophie, heard it from Rachel, and your good self, Scott, and just being able to, pick yourself up. I thought it was really interesting what Rachel said. Do you identify with that about, even watching, as Rachel described it, rubbish TV? I'm careful because I've probably been in a lot of it. But, watching that, that's not enough. You've got to actually empty your mind and have no stimulation at all, just to sort of get your head together, Scott. Did you get that one?
Yeah, again, I find within 6 hours, I'm absolutely physically and mentally just sort of drained. It's not even a physical job that I do now; it's just a desk job. But even then, 6 hours, I feel like I've done 12. And it's you get home after 6 hours and you have to rest. It's you have to. It's not sort of like, I'll have to sit down for half an hour. I have to have a lay down.
Can I come in briefly on that?
Yeah, please.
We use the word fatigue, and it just doesn't cover it. It's nothing. It's like nothing else you've experienced. There's no. I'm getting a bit tired, but I can do a bit more. It's a wall, and it's your entire being. It's your brain, your body, emotionally, everything. You're done, and you can't fight through it when it really hits. You have no choice. I've been caught in a surgery. It was a 45-minute drive from home, where because there was more traffic than usual on the way to work, I did more than the hours I had planned to do, and I've been stuck there and had to get a family member to drive down and collect me and leave my car because I couldn't get home safely.
Anne in Penrith. Good morning, Anne. Thank you for raising this the other day when
Hi.
we were doing our phone-in, asking people to talk about stories we need to cover. And I'm glad that we're doing.
Back to it.
I'm glad we're doing it because the response has been incredible. What would you like to say this morning?
Well, I think you can tell from all of these phone calls that people are struggling, people are suffering, and I don't understand what the long-term plan is here. If we are going to continue to allow everybody to do nothing and not prevent transmission at all, and allow everybody to get repeatedly infected until everybody is experiencing harm, and obviously that is a spectrum of harm, then what is the long-term plan? We're going to end up with a population whose health has been decimated because our politicians didn't choose to take preventative measures.
What do you want them to do now? Because we
need air
inquiry
filters.
is hearing from. I'm just going to tell people the inquiry this week is hearing from long COVID experts. They're hearing from those experts today. Sorry, Anne. What do we need to do now?
I feel like we can talk about this. We're all talking about this, and everybody's saying how horrendous it is, and isn't this terrible? We need action. We need people to start understanding that there are things that we can do. There is a Green Party policy which has been written. The Green Party MPs haven't spoken on it yet. It's an excellent policy. Andrew Gwynn needs to speak up. We need air filters in schools and hospitals. Schools, hospitals and healthcare drive transmission mostly. So we need to clean the air. It's an airborne virus. We need to change the IPC guidelines so that air is going to be, we are all breathing clean indoor air. That is the first thing that we can do. We need to have masks in healthcare because we've got people who are going in to access healthcare. They are catching COVID when they are trying to access healthcare. That is ridiculous. And I think the statistic was that 10% of people who catch COVID when they're in hospital die. Why is it that you can't go in and access healthcare safely? We've got a third of healthcare workers who are affected by long COVID already. We're not going to have any healthcare workers left. And the recent Locomotion study said that 52% of people had to reduce or stop work. That works out at 5.7 billion that's been lost. This is not a historical problem. The COVID inquiry are framing this as a historical problem and talking about all of these things as if it's a post-pandemic problem. We're still in the pandemic.
Ongoing. Yeah,
We've still got people who are struggling right now.
Allow me to do the government statement. Then we're going to hear from Joe, and I'd be interested to know the cumulative effect, the ongoing effect in the Western world in general, wouldn't it? Because people are talking in every country about economic inactivity. The Department of Health and Social Care said the government will ensure patients receive the care they deserve. We're committed to improving the care and support for people with long COVID, ME, and chronic fatigue syndrome. We recognise how devastating the symptoms can be and the significant impact they have on patients and their families. The spokesperson said the government welcomes applications for high-quality research to understand the causes, consequences, and treatment of ME, CFS, and long COVID. We are actively exploring next steps for research in this area. That's what they say. What about you, Joe? And thanks for that, Anne. Joe in Hertford, your husband is going through this, right?
Yes, he is. Hi, Nicky.
Hi, Joe.
I only wish he could be on the call instead of me, but this sounds ironic to say, but he is on a work Zoom call, so he's not aware that this is actually taking place. But in order to do his work Zoom call, which I believe goes on for about 2 hours, he had to have a half-hour sleep beforehand, and as soon as it ends, he will be utterly shattered, both physically but more mentally, because he's leading the meeting. His cognitive processes will be exhausted. So at the end of his Zoom call, he will be straight back to bed for probably half an hour. A few years ago, he would have had to go straight back to bed for an hour. Well, in fact, a few years ago, he was off work for 6 months. We were incredibly lucky. His company was superb. But he has had it 4 years now. And to this day, he is still requiring 3 sleeps every single day, spread throughout the day, to get through work. He is back at work, but he's part-time. And he has had to find ways to sleep in some of the most bizarre places imaginable. For example, if he can't get a quiet meeting room at places where he has to go to work, he will have to go back out to his car, have a sleep in the car, possibly put an eye mask on, that sort of thing. Socially, I was saying to the producer, if he goes to a sporting event, he is sport mad. For example, he might go to cricket at Lord's, and in order to get through a really enjoyable, sociable day, he has negotiated that he can go into the multi-faith prayer room there to have a sleep, because he cannot sit at cricket, particularly if he goes with a friend, to enjoy it, because he can't talk to the friend, concentrate on the cricket, have a nice time without sleep.
That's jaw-dropping. That is jaw-dropping.
Yeah, and I said as well, he will arrange to not travel up on the train with a friend to something like that, because he knows that if he goes on the train with the friend, however understanding they might be, they will want to talk. He can't talk on a train for an hour and a half, go to the event and get through it, and then potentially talk on the way home. He just can't manage that. He loses his voice. His voice gets really weak. He loses his train of thought. At the beginning, I said, he couldn't finish a sentence because he couldn't think of words. And it was like talking to someone who had early stage dementia, because he would find that really difficult, to the point that he would often end up in tears, because he knew what the word was that he wanted to say, but he couldn't find it and he couldn't verbalise it. And that was very scary for both of us, because it was very early days. We didn't really know what was happening to him in his body. And we both actually had parents with dementia, and it was incredibly similar and very, very difficult to deal with.
Sophie, and everybody, thank you so much. There's a load of texts, and I don't want to launch into them because I won't do justice to them, but suffice to say, lots of people are suffering. And if you don't mind, we've got your contacts, and when we next discuss this, we'll text you or whatever, see if you want to come on and talk to. So many people are saying so many amazing things about this.